Hi, welcome to Eye Acupuncture, presented by Lamp AccuWellness Foundation, Inc. as part of its continuing Lamp Lecture series. Introduction, Eye Anatomy, 4 regions, 8 areas, 13 points. With eye acupuncture, the eyes are used for both the diagnosis and the treatment of disease. To treat disease, select points along the orbital margin of the eye for stimulation. Eye acupuncture is different from other acupuncture microsystems in that the changes in the vessels of the bulbar conjunctiva are observed for diagnosis. Point selection and treatment principles are based on these findings. This therapy is easy to use, provides rapid and excellent results, and is safe and painless. Eye acupuncture was invented by Dr. Pang in China in the 1970s. He introduced it to the world in 1986. Eye acupuncture therapy is based on the theory of the Neijing and the famous Dr. Hua Tuo, who observed the eyes to formulate his diagnosis. The eyes connect the energy of the Zangfu organs externally and reflect the body's qi, blood, nutritive qi, protective qi, spirit, and ethereal and corporeal souls. The 12 meridians connect directly or indirectly with the eyes. Stimulation of the eye around the orbital margin can open the meridians, invigorate blood, stop pain, calm the shen, and regulate the Zangfu function. External eye anatomy. The orbital opening is the house of the eyes. The supraorbital margin is formed entirely by the frontal bone. The supraorbital notch is located at the lateral 2/3 of the margin and is the location that transmits the supraorbital nerve and vessels. The lateral margin of the orbit consists of the frontal process of the zygomatic bone and the zygomatic process of the frontal bone. The inferior border of the orbit is formed by the zygomatic bone laterally and the maxilla bone medially. The frontal bone above and the frontal process of the maxilla bone below form the medial margin. The eyelids are 2 thin movable folds that cover the anterior surface of the eye. The upper eyelid is more mobile and contains an elevator muscle. Skin that is thin externally and covered by conjunctiva internally covers the eyelids. The supporting framework of each eyelid is formed by dense fibrous tissue. The main muscle within the eyelids is the orbicularis oculi. The facial surface of the eyelids consists of skin, subcutaneous connective tissue, fibers of the orbicularis oculi, and submuscular connective tissue. The skin is extremely thin. The subcutaneous connective tissue lacks elastic fibers. Submuscular connective tissue is continuous with the subaponeurotic layer of the scalp. The lateral and medial palpebral arteries supply the eyelids. The superior arteries supply the upper eyelids, and the inferior arteries supply the lower eyelids. Branches of the infraorbital, facial, and transverse facial and superficial temporal arteries also supply the eyes. The veins of the eyelids are larger and have more branches. The veins pass either superficially to the veins on the face and forehead or deeply to the ophthalmic veins within the orbit. The cutaneous nerves of the eyelids come from both the ophthalmic and maxillary divisions of the trigeminal nerve. The supraorbital branches of the frontal nerve, lacrimal nerve, and nasociliary nerve mainly supply the upper eyelid. The nerve supply to the lower eyelid is the infraorbital branch of the maxillary nerve. For eye acupuncture, insert the needle on the superficial skin, the subcutaneous connective tissue, or the space between the orbit and the eyeball. Due to the thin skin and superficial blood supply, use caution to prevent injury to the eyeball or bleeding that can cause a black eye. Locations and indications. Eye acupuncture locations consist of a total of 4 regions, 8 areas, and 13 points. With your eye looking straight ahead, draw a horizontal line connecting the inner canthus with the outer canthus. Draw a vertical line from the infraorbital region and the superior orbital region, dividing the eye into 4 regions. Each of the 4 regions is then further divided into 2 separate areas, making a total of 4 regions and 8 areas. The left eye belongs to Yang, and the 8 areas flow clockwise. The right eye belongs to Yin, and the 8 areas follow a counterclockwise flow. Zangfu of each area. The left and right eye each have the same representative Zangfu areas. The first area is the lung and large intestine. The second area is the kidney and urinary bladder. The third area is the upper jiao. The fourth area is the liver and gallbladder. The fifth area is the middle jiao. The sixth area is the heart and small intestine. The seventh area is the spleen and stomach. The eighth area is the lower jiao. There is about 45 degrees between each area. The concept of Sanjiao in the eye acupuncture system represents the whole body, interior and exterior. The upper jiao represents the whole area above the diaphragm, including the head, face, eyes, ears, nose, mouth, throat, arms, upper back, chest, lungs, esophagus, and trachea. The middle jiao is everything between the diaphragm and the umbilicus, which includes the middle back, upper abdomen, and the zangfu of that area. The lower jiao includes everything below the umbilicus, including the lower back, the hips, the abdominal cavity, the reproductive and urinary systems, and the legs. The 13 points are distributed as follows. Area 1, Area 2, Area 4, Area 6, and Area 7 each have 2 points that indicate 1 Zang and 1 Fu organ. Area 3, Area 5, and Area 8 each has only 1 point. The eye microsystem condenses the whole body's 361 points into 13 points, distributed around the orbital margin, about 1 centimeter from the edge of the orbit, each with specific functions. The points are named according to the Zangfu they represent. Each point treats disease within the representative Zangfu and Jingluo. Area 1. Organ, lung. Indications: cough, asthma, sore throat, and chest pain. Organ, large intestine. Indications: diarrhea, constipation, abdominal pain, and abdominal fullness. Area 2. Kidney and urinary bladder. Low back pain, weakness of the knees, tinnitus, spermaturia, impotence, and infertility. Urinary incontinence, urinary retention, frequent urination, urgent urination, and painful urination. Area 3. Organ, upper jiao. Indications: problems on the head, face, neck, chest, and back, as well as lung problems and heart conditions. Area 4, liver and gallbladder. Indications: hypochondriac area pain, headaches, dizziness, red eyes and jaundice, gallstones, and cholecystitis. Area 5, middle jiao. Indications: problems in the upper abdomen, middle back, and lumbar, as well as spleen, stomach, liver, and gallbladder conditions. Area 6, heart and small intestine. Indications: palpitations, chest pain, insomnia, and forgetfulness. Diarrhea, borborygmus, and abdominal pain. Area 7, spleen and stomach. Indications: fullness of the abdomen, poor appetite, diarrhea, weakness of the 4 extremities, and edema. Stomach pain, nausea, vomiting, belching, and acid reflux. Area 8, lower jiao. Indications: problems in the lower abdomen, hips, buttocks, sacral region, legs, and reproductive organs. Thank you very much for your attention, and see you in our next videos.